Hey everyone, welcome back to Ask Dr. Slater. In this series, you get to ask me, a board-certified orthopedic specialist with 17 years experience in this field, your healthcare questions. So if you found this helpful, make sure to like and subscribe so you can submit your own questions that we'll be answering each week. Let's get to it. Are all the tests you're doing coming back negative for your pain? So this person writes, I have severe pain in my cervical spine, but all tests come back clear. So they don't do anything. It's been 9 years and I can't even sit upright for more than an hour or two. Yeah, and this happens a lot because the medical system is just strongly reliant on imaging, but imaging is more flawed and misleading than most people realize. Number one, by the time you're 40, you should have something on your imaging. You should have degenerative disc disease, herniation, spinal stenosis, facet arthritis, whatever, something, because these are just natural changes that happen over time. And often they're present without symptoms. There's so many studies to show this, but we don't even act like that in the medical system. We act like we need to find something and then we need to treat that, and we can only do it if we find it on an image. But your symptoms matter more. Your symptoms, how they behave, where they are, when they are, that should matter more than an image. So if you're out there and you're getting treatment based off of your image, just remember that this isn't the be-all end-all like we use it. Injections aren't treatment. They're typically just masking your symptoms. This is almost all the time, especially when we're talking about pain. This person writes, if you get a cortisone injection in your back, will it get rid of plantar fasciitis and Achilles tendonitis? I've had injections in my foot and it was pain-free for 2 weeks. And that's great, and I get that you want to be out of pain, but pain-free for 2 weeks, just being numb to your symptoms because there's pain medication in those injections, as well as the steroids, they will both wear off, and then you'll be left the same or maybe even worse than what you were because you were operating as if you were better. You were doing things that were hurting you, but you weren't realizing it. Or the injections itself are actually damaging your tendons, your joint. And this is the case. Look it up. These injections aren't great for you, but they're used all the time to treat you, even though they're not treating you. They're just managing your symptoms. So even if an injection into your back would help your plantar fasciitis or your Achilles tendonitis symptoms, it's not going to treat you. It's not going to restore motion. It's not going to restore strength. It's just going to numb you to your symptoms. If you have back trouble, could that be the root cause of neuropathy? Yes, absolutely. And just remember that neuropathy is kind of an overused blanket term, meaning the two main causes of neuropathy. One is diabetic. That's about 30 to 50% of the time for neuropathic pain is diabetic neuropathy. You have diabetes, it's affecting your nerves, you have neuropathy. The second largest one, by about 25 to about 45% of the time, is idiopathic. Idiopathic is the medical term for unknown cause, meaning we have no idea what's causing your neuropathy. And this is one of the largest. Again, outside of diabetic, it is the largest cause of, or the largest type of neuropathy. So be careful when you get diagnosed with neuropathy, because most of the time what you're being told is, hey, you have nerve pain and we don't know why. Person writes, I was told the back pain doesn't affect the bladder, so I had a bladder sling put in, but I still leak. Your nerves innervate your muscles, your tendons, your fascia, your joints, and they innervate your organs. They innervate your bladder. And a problem with your back, a problem that would put pressure on a nerve, can cause your symptoms, can cause your bladder symptoms. And this will lead you to be diagnosed with stuff like IC or bladder pain. And it's often not actually the bladder, it's often actually the back. So if you're out there and you're having urinary symptoms and you're also having back pain, start thinking that it's one problem, not two separate problems. That's it for this week of Ask Dr. Slater. Make sure to leave your questions in the comments. Make sure to hit like and subscribe so you don't miss this series. Stay tuned next week.